Jai Hind student, in this we are going to discuss the problem and challenges of health. Improvement in the health of the population has been one of the major thrust area of the social development program of the country. This was to be achieved through the improving the access to and utilization of health service with special focus on underprivileged section of the population. It has resulted in substantial improvement in the health index of the population and steep decline in the mortality. And they are the first point: inadequate inefficient health infrastructure facilities. The existing health system suffer from inequitable distribution of institution and manpower. There are huge gap in primary health care system, especially in the remote, rural and tribal area. Therefore focus should be on reorganization and restructuring of the existing health care system. Next, inadequate healthcare service in rural areas. Majority of government had private sector hospital bed are located in urban areas. Qualified and registered private sector doctors, private sector institutions are not readily available in remote, rural and tribal area because people do not have ability to pay. Thus, the people in these areas have low access to the government health service or private facilities. Moreover, the unqualified person still provide health care, especially to the poor segment of the population living in urban slum and remote rural tribal areas. Next, public private partnership. There is need to be increased public private volunteer sector cooperation to meet the health care need of the poor and variable segment of population. Some sort of norms ethical standards should be developed in regarded to healthcare system in the country. Next, quality and accountability in the healthcare. In recent years, there has been increased public concern over the quality of healthcare, both because of increasing awareness of population, monitoring of health institutions, particularly in the private sector. Some initiatives have been recently been taken to address issues relating to quality of healthcare and inclusion of health sector under the Consumer Protection Act. Next, control and management of communicable diseases. Communicable diseases have become more difficult to combat because of development instance resistant strain of the vector, antibiotic resistant strain of bacteria, emergence of HIV infection, and urban rural settings. Poor liquid solid waste management. Overcrowding contribute to increase the prevalence of the communicable diseases. Immediate attention is needs to be prevention of infection through the effective implementation of infection control measures. Next, non-communicable diseases. Longevity and changing lifestyle have been resulted in the increased prevalence of non-communicable diseases. Under the nutrition, micronutrition deficiencies associated with health problem coexist with the obesity and non-communicable disease. Next, inadequate water supply and sanitation facilities. Water supply and sanitation are the basic need for the improvement of the quality of life, enhance of the productivity efficiency of the people. Rapid urbanization and industrialization have been multiplied the challenge of providing these basic amenities. The poor bear a higher burden of non-availability of water as well as its poor quality. The condition of sanitation facilities is poor both urban and rural areas. However, it is the worst in rural areas. Beside all these above mentioned shortcomings, there is a persistence of extreme inequality and disparity both in the terms of access to care as well as health outcomes. India is the midst epidemiological demographic transition which increase the burden of chronic disease and decline in the mortality and fertility rate aging of the population. Next, vision of the future. There is objective to achieve good health for people, especially the poor and the underprivileged. In order to this comprehensive approach, it need to be which compass individual health care, public health, sanitation, clean drinking water, access to food, knowledge of hygiene, feeding practice. Importance should be given to reducing disparities in health across region communities by ensuring access to affordable health care. Aggregate spending on health should be increased significantly. The contribution of private sectors providing health service should be enhanced. The country should strive to achieve health as a right for all.